Welcome back to my channel. Today we're going to solve a math equation, but not just any equation. We're talking about the ultimate equation for happiness. Left-hand side equals right-hand side. But what's on the left-hand side? Tea and Panadol. And what's on the right-hand side? Happiness. Ha ha. Tea is such an important thing, especially for us Desses. Whether you've got a headache, you're feeling sleepy, or you're just bored, tea is the answer. Ha ha ha. Studies, tea, guests at home, tea, hanging out with friends, tea, need to talk to someone, tea and conversation, perfect combo. Oh, for sure. I mean, tea is so important that we all go crazy for it. We don't care about the ingredients as long as there's tea in it. Water, milk, who cares? Tea is all that matters. So, what's your favorite way to enjoy tea? But, it actually has some bad effects that need to be noticed. Here's a breakdown of the bad effects of tea over time, especially if you drink too much. In the short term, like within hours to days, in 0 to 1 hour, you might feel increased alertness and energy, thanks to caffeine stimulation. Then, in 1 to 3 hours, you could get acid reflux or an upset stomach, since tannins can irritate your stomach lining. After 2 to 6 hours, you might notice more frequent urination, because tea is mildly diuretic. And if you drink it late, in 6 to 12 hours, you could have trouble sleeping because caffeine stays in your system. Okay, so let's talk about the medium-term effects, which happen over weeks to months. Over a few weeks, you might experience anxiety or restlessness because caffeine can overstimulate your nervous system. After 1 to 2 months, there's a risk of iron deficiency, like fatigue or pale skin, since tannins block iron absorption from food. If you keep it up for 2 to 3 months, you could develop dependence or even withdrawal, because the caffeine habit builds up and stopping can cause headaches or irritability. And for the long-term effects, which means years after 1 to 3 years, you might have lower bone density, since excess fluoride or caffeine affects your calcium balance. After 3 or more years, there's a risk of chronic anemia, especially if you drink tea with meals, because of persistent iron absorption issues. Ongoing tea drinking can also lead to dental staining, since tannins discolor your teeth enamel. And if it becomes a daily habit, you might struggle with sleep disorders or chronic fatigue just from poor sleep due to long-term caffeine use. So, who's most at risk? Well, pregnant women, because too much caffeine isn't good for them. Children, since they're more sensitive to caffeine. People with anemia, obviously. Those on blood pressure or heart medications. And of course, people with acid reflux or GERD.